Right, good morning. I think we'll get started. I'm Mary Hanson from the Credit Union, and happy to see all of you here today, in person, but also to all of you that are joining us virtually. We have the pleasure today to welcome some of our colleagues from our state trade association, the Minnesota Credit Union Network. This group serves over 2 million credit union members across the state of Minnesota. And several of our leaders here at MEFCU are involved in different committee work that's done at the state office. But today, we have the pleasure of having Dave Brown and Michaela here from the State Trade Association. They are industry specialists in Medicare. They will advise members on the Medicare plan that's maybe best for them. They work with our members, certainly, across the U.S., but they also will work with your family members. So if you have siblings or other family members, maybe you're here looking for a family member, they are eligible not only for membership, but to work with this group from TrueLink Advisors. As we all know, when you turn 65, it can almost be overwhelming with the different postcards, mailings, calls you might get. Certainly television ads that we see about your options. And there's many different things we have to look at when we consider what plan is best for oneself. So today, we have our presenters here, and Dave Brown, I believe, will actually do the presentation. He has been working with clients in the Medicare space for 16 years, and most recently has been working with the Minnesota Credit Union Network and credit union members across our state. Heard some tremendous reports on his work with individuals and their testimonials as to their experience. And so we're excited to have him participating with our members. Dave, in his past, has also served 2 terms as a Minnesota State Senator and was a strong supporter of credit union policy and legislation while serving, which is very important to us, of course. It's been my honor to get to know Dave, and I value and I appreciate his knowledge, his style, and I know that his true interest is helping people. So with that, I'm going to turn the presentation over to Dave. Thank you.
Thank you, Mary. I appreciate that, and thank you for attending today, whether you're virtual or for those of you in person. And if you are in person, you picked up a folder like this. Inside, there's just some educational material that we use. I happen to use materials from United Healthcare. We don't favor one carrier over the other, but they just do an excellent job on putting together materials for you. There's a handout on how HSAs work if you are still working and trying to decide if you want to go on to Medicare Part A or Part B. And then there's also a handout on 15 commonly asked questions about Social Security, about when should I go on to Social Security and all that. So those are just helpful handouts. And then also, depending on the folder that you picked up, you'll have a card that looks like this. And if you're virtually, at the end, we're going to have a slide with our contact information for TrueLink Medicare Advisors. If you want us to schedule an appointment with you, whether it's in person or virtually or over the phone, if you fill out one of these forms and leave it with us at the end, or virtually if you send us an email or text, we will get in touch with you to discuss your specific situations. So again, my name is Dave with the Minnesota Credit Union Network. Our organization is called TrueLink Medicare Advisors, and we're here to be of help to you. So today's presentation is going to be on the basics of Medicare and disclosure. Medicare requires disclosures. It's probably hard to believe, but the federal government requires a lot of disclosures. And so we represent all 7 Medicare Advantage plans in Minnesota. In addition to that, there's several Medigap or Medicare supplement plans available. And of the 7 organizations, they have over 45 different options from which you can choose. If you're in Wisconsin or another state, there's even more options than that. This is an educational event. We're not going to sell you anything today. We're going to cover the basics of Medicare. If you do decide to use our services, there's never a cost to you for that. So how we get paid is if you go through TrueLink Medicare Advisors and you end up signing for a Medicare supplemental plan through us, we get paid a commission by the insurance carriers. You will never receive a bill from us. You will never pay us anything. So just want to make that clear to folks. So our agenda today is why should you use TrueLink? What is Medicare? What does it cover? What doesn't it cover? The different enrollment periods and deadlines that you need to be aware of. Different costs that are associated with Medicare. What if you decide to work past the age of 65? We're going to talk about that. And then your private insurance options. So if any of you watch television, especially from October through December, you've seen Medicare ads on the TV. And you've seen Joe Namath or William Shatner or J.J. Walker or probably others too, telling you why you need to call their 1-800 number immediately to get all the benefits you deserve. If you're in Minnesota, a lot of the benefits they talk about aren't even available in Minnesota. But what they're going to do if you call that number, and I hope you don't ever call those numbers, but if you do, they're going to, not them, but the organization that pays them to do their ads is they're going to sell your information to another agency they work with. They're going to hound you until they get an appointment set up, and then they're going to tell you about the couple of plans they represent. One of the reasons we represent all the plans available in whatever state, in Wisconsin, we represent all the plans available, Minnesota, we don't want to be biased in what might be best for you. So we're going to offer you whatever plan works best for you. So you've seen these. Also, around the time you turn 64, your mailbox is going to start filling up with postcards and mailings about why you should go with this plan or that plan once you turn 65. If you go through us, you don't have to worry about any of that. So TrueLink Medicare Advisors, again, there's no cost to our services. And just so you know, when I mentioned 7 different insurance carriers that we represent, several years ago now, probably over 10 years ago, Medicare standardized the commissions we get paid. When I first started in 2008, you know, if we sold X number of plans with this carrier, you could win. The agents were winning free trips and all of that. It was not in the consumer's best interest because you didn't know any of that was going on. Medicare standardized that. Nobody gets to win free trips anymore, and we get paid the same commission by whatever insurance carrier we put you with. So the whole point of that was, and it was good that they did that, is we're not going to have some undisclosed bias in saying, well, maybe you're better off with Blue Cross or UCare or Medicare or United Healthcare, whatever. What we're going to do when we meet with you is we're going to ask you for a list of your providers. What clinics are you going to? What doctors are you seeing? Who's your dentist? We'll make sure that they're in network with whatever plan you choose. And then we're also going to look up any prescription medications that you're taking to make sure that the insurance carrier covers those. So some of the things we'll advise you on is when you should enroll in Medicare Part A and B. We'll talk about that in a little bit. What if you decide to work past the age of 65? Do you need documentation from your employer so you don't have to pay a penalty? And the answer to that is yes, you would, and we'll talk about that. What is Medicare going to cover for me? Why do I need supplemental coverage beyond what Part A and Part B? Should I enroll in Medicare if I'm still working? Those sorts of questions. How does Medicare impact HSA contributions? We'll cover that. So original Medicare. Original Medicare, there's 2 parts to original Medicare. It's Part A and Part B. And one thing I didn't say at the beginning, which I should have, anytime during the presentation, if you have questions, just raise your hand and ask. If you're virtual, if you want to enter something into the chat box, we will try to get those answered for you too. You don't have to save your questions until the end. If you have a question about anything I say that maybe it doesn't make sense to you or whatever, just feel free to ask questions as we go along. So, with original Medicare, Part A is coverage for your hospitalization, any skilled nursing. And skilled nursing would be if you're in the hospital and you needed recovery time and you couldn't do that at home. That's skilled nursing. Part A covers that. Any home health care and hospice care. Typically for Part A, if you or a spouse has worked in the United States for at least 10 years, you've paid the Medicare tax. It comes right out of your paycheck. You won't have a premium to pay for Medicare Part A. However, for Part B, And Part B is going to be for doctors and specialists, outpatient surgeries, any of the outpatient type of things, ambulance, MRIs, CAT scans, all of that. There is a monthly premium for Medicare Part B, and this year that starts at $174.70 a month. Now people say, well, how do I pay that? So if you're going to be collecting Social Security benefits when you sign up for Part A, Social Security is going to take it right out of your Social Security check. You won't even see it. If you're delaying your Social Security benefits when you sign up for Part B, they're going to send you a monthly bill to pay. Actually, they send you a quarterly bill, but there will be instructions on how, if you want to pay it monthly, you can set it up with your checking account or share draft account or whatever to have it paid automatically. Once you start collecting Social Security benefits, they'll take your Part B premium right out of your Social Security check. Any questions on that? That $174.70, that can change. It changes a little bit from year to year. They typically announce that in October or November. Being that's an election year, if it's going up, they'll wait till after the election to announce it. If it's going down, they'll announce it before the election. So people laugh, but that's been the history of it. So, yes? So I don't cover those for a reason, and I should have. So those costs per day that you see, that's if you just have original Medicare Part A and B. If you were in the hospital, you would have a deductible of $1,632 you'd have to pay for the hospital. And then if you were in more than 60 days, which is very rare these days, you'd have a per day cost. When you sign up for a Medigap plan or a Medicare Advantage plan, those numbers don't impact you for the most part. It would just be a copay. Same with the annual deductible on Part B. That would apply if you have a Medigap plan. It doesn't apply if you have a Medicare Advantage plan. And we'll go over those. So original Medicare is medical insurance. It does not provide a 100% coverage. There's also things original Medicare does not cover. Original Medicare is not going to cover any dental unless it's for the very limited things Medicare covers. It won't offer you fitness benefits or worldwide coverage. It's not going to cover your eye exams or eyewear, hearing exams or hearing aids, and it doesn't cover your prescription drugs. So with Medicare Advantage plans, all of the plans in Minnesota are going to include all of these benefits for your monthly premium. With Medigap plans, they don't offer these things, but you would get, if you went a supplement or a Medigap plan, you would pick up what's called a standalone prescription drug plan if you wanted prescription drug coverage. So these are some of the reasons why you have agents selling supplemental coverages. There's just a lot original Medicare doesn't cover that you probably want coverage for. Then in enrollment periods. So based around your 65th birth date, it's what's called the initial coverage enrollment period. It starts 3 months before the month of your 65th birth date. So if your birthday was in June, you can actually sign up 3 months prior to that, the month of, or 3 months after, based on whatever month your 65th birth date ends. That's the time you'd sign up. However, if you or a spouse are still working and you're going to continue to work past the age of 65, and say you and your spouse are both on the employer plan of whichever spouse is working, you can delay enrolling in Medicare Part A and B until you're ready to retire. The caveat to that is your employer needs to employ 20 or more people. If you work for a small employer that employs less than that, then you would need to sign up for Medicare Part A and B at the time of your 65th birth date. Yes? Okay.
Is there anything that I can, get maybe cheap, save like at my last month, because I'm going to be going over Medicare, let's say in June, so can I get away without paying my May monthly premium on my current policy?
Is it like a COBRA?
No,
Or no? Is it taken out of your paycheck?
I'm retired, so I
Oh,
would mail, they cover me, I'm under a program, I get their monthly premium.
Yeah, so the question was, can he, you said because you're, you're cheap, is that what you used? Can you go a month without health insurance?
I go a month without
So
the healthcare, I just want to know if I have to pay that last month's premium.
you would have to pay the last month premium prior to when you're eligible for Medicare, because if you didn't, you wouldn't have health coverage.
That was my question.
Yeah.
I wanted to know.
Okay. Any other questions? Okay. Then there's there's several enrollment periods. The next one is a special election period. This is for people who begin or who work past the age of 65 because they have employer coverage and they don't want to sign up, especially for the Medicare Part B yet, because they don't want to pay that $175 a month, and they don't need to if they have employer coverage. So this is for people once you're ready to retire, about 2 months before separation from your employment, you're going to want to get signed up for Medicare Part A and B, and that's something that we can help you with. You can do it online. You go to ssa.gov, and there's an icon right on there. It says sign up for Medicare. So you'd click on that, fill out the form. If you're working past the age of 65, there's also a form you need from your employer. It's just a simple one-page form, and your employer fills out the first section, you fill out the second one. And if you're applying for Part B online, near the end there's a place to upload that form before you submit your application for A and B, and that's what prevents the penalty. Because if you don't sign up for Medicare Parts A and B when you're 65, you have to have a reason for not doing that, or you'll be assessed a penalty down the road when you do. Having employer coverage is one of those reasons that will prevent that penalty. Either for you, so let's say you're the one who's working and your spouse is on your employer plan, and if you're both turning 65, both of you can delay enrolling in Medicare Part A and B until the spouse who has the coverage through the employer is getting ready to retire. Then you can sign up for Medicare Part A and B. So some people say, well, my employer says I should sign up for Medicare Part A because I don't have to pay a monthly premium for it. You can do that based around your 65th birth date. The reason you wouldn't want to do it is if your employer plan is an HSA where you're contributing to a health savings account. If you're contributing to an HSA health savings account, you do not want to sign up for Medicare Part A. Technically, you're not allowed to. But if you do, you're going to be taxed pretty heavily on your contributions to your HSA. You don't want that to happen. So if you're in that position of you're going to continue working and you're on your employer plan, if you have an HSA, don't sign up for Medicare Part A. Yes?
So what you said, my husband is currently working at Mayo and I'm retired and I turn 65 in December. Are you saying if he continues to work, he can cover my I don't have to sign up for Medicare yet because I'm covered under
If you're on his employer plan,
they don't drop me
no.
because I'm 65.
No. However, you may want to compare the costs. I don't know what the costs are to have like a dependent on the Mayo plan or your employer plan, but if it's significantly more expensive, you may want to consider getting off of your spouse's plan and going on to Medicare. So the costs you would look at, you're going to pay roughly $175 for Part B, and then Medicare Advantage plans start at $0 a month and go up to about $100 a month. So if those costs are less than what it is for you to be on your spouse's plan, you may be better off going on to a Medicare plan.
And I did just start collecting Social Security, so it says it automatically enrolls me. And so do I have to fill out that special form you just talked about?
No, so if you're collecting Social Security benefits or signed up to at the age of 65, they will automatically enroll you in Medicare Part A and B. If you don't want it, they're going to send instructions when your Medicare card arrives, and that's going to arrive about 3 months prior to your 65th birth date. There'll be instructions on how you can delay enrolling in Medicare Part A and B. They can suspend that. Okay. Yeah. Yes.
So this is a question from online. Bruce Daniels asks, if I'm going to continue to work past 65, my Mayo insurance covers me and my wife. Should I still apply for Part A at 65? I want to be sure my Mayo insurance continues for my wife and myself while I continue at Mayo.
Okay. So it depends. If your Mayo plan is an HSA plan, If it's under your name, then you don't want to sign up for Medicare Part A. Your wife could if she's not the one contributing to the HSA. But if you're going to continue working, both you and your spouse are on the Mayo plan, neither one of you needs to sign up for A and B. Again, go ahead and sign up for Part A if you don't have an HSA. But otherwise, you don't need to sign up for Part B. If there's a significant cost savings to the spouse to go on to Medicare, by, you're paying the single rate instead of you plus one or you plus family, it may be worth it. But otherwise, neither one of you needs to do anything at the time that you turn 65 if you're going to continue to work and on the Mayo plan. Okay? Then every year, there's also an annual election period. So every year, once you're on Medicare, from October 15th through December 7th, you're eligible to switch to another plan. If you don't like that plan, or if there's major changes to that plan, every year going forward from October 15th through December 7th, you're able to compare your other options and make a switch for January 1 of the following year. There are reasons that I read the statistic the other day, 15% of people on Medicare actually have their plans reviewed every year. Plans change every year. You're going to receive, from whatever plan you sign up with, they're required to send you what's called an annual notice of changes every year. You'll get that sometime in September. It's a pretty thick book, and they're going to tell you any changes in co-pays, premiums, if what prescription meds they're going to cover for the next year, which ones they're not going to cover. So they might cover all of your prescriptions this year, but that could change for the following year. And if you don't have your plan reviewed or you don't read through your annual notice of changes, you could find out come January that there's a medication that was covered this year that's no longer going to be covered next year. So that's one of the benefits of meeting with us on an annual basis. We love to review our clients' plans every year to help you decide, these are the changes that are coming. Are you happy with what you have? Do you want to look at other options? Those sorts of things. There will be major disruptions this fall for anybody who's on Medicare. There's some big changes for the prescription drug portion coverage, and I'll go over that in a little bit, but that's going to cause some disruptions this fall. So for those, if you know of people who've been on Medicare several years and they've never really reviewed their plan, it would be advisable to do that this fall because they could see some significant changes for January of next year. And then the other enrollment period we'll cover is the Medicare Advantage open enrollment period. This is fairly new within the last 5 years. This is for people who have a Medicare Advantage plan. And let's say you didn't review your coverage. You thought, I love the carrier I have. I've loved the plan I have. But then come January, you go to the pharmacy and find out one of your prescriptions isn't covered or whatever the reasons are. You have one more opportunity from January 1 through January 1 through March 31st to make one more switch if you want to do that. And what you can do is you can make a switch from one Advantage plan to another Advantage plan, or you can just drop it all together and just go back to original Medicare with a prescription drug plan. That's not the advisable thing to do, but that's an option that you have.
I don't understand the difference.
Okay, so the time frame is the annual election periods, October 15th through December 7th. That's for everybody, whether you have a Medigap plan or a Medicare Advantage plan, standalone prescription drug plan. But let's say you didn't bother to make the switch during the annual election period. And then when January comes and the realities of your plan changes come to light because you didn't really understand the changes, and you're not happy with those changes that your plan made for January of the following year, you're going to have an opportunity from January 1 through March 31st to switch to a different plan that might work better for you. Does that make sense?
So the first one covers more than just Advantage plans?
Well, it's going to also include the standalone prescription drug. So if you have a Medigap or a Medicare supplement plan, you most likely have a standalone prescription drug plan to go with that. So that covers the standalone prescription drug plans. And actually, if I can confuse it anymore, I hesitate to say this, but The Minnesota legislature last year created an annual enrollment period for supplement plans in Minnesota. So starting next fall in 2025, you can get onto a Medigap plan or a supplement plan. Those ask you health questions if you wait beyond 12 months of turning 65 or when you're first eligible. In Minnesota, you're going to be able to sign up for a Medigap plan starting next fall in 2025 without the health questions. So that's going to add to the mix next year in Minnesota. So there are some reasons people in Minnesota, they choose to go with a Medigap plan, supplement plan. They're considerably more expensive. But if you get the ones where you don't have copays, you pay a $240 deductible, and then you don't have any copays to pay. So, because people think, well, I'm healthy now, but 10 years from now, I don't know what my health is going to be. So that's a reason a lot of people start out with a Medigap plan. They're paying a lot more money for them. Well, starting next fall, that's not going to be a big worry for you because Minnesota has implemented an annual enrollment period for Medigap plans. So if down the road, maybe you're in your 80s and you're going to the doctor a lot and you're just thinking, I'm tired of paying copays. In Minnesota, you're going to be able to sign up, move from an Advantage plan to a Medigap plan, October 15th through December 7th, without health questions. Meaning if you want one, you can get it, if you want to pay for it. I don't know if that answered your questions or not. I probably went into the weeds a little more than I needed to. Yes.
So Jolie Gruber, who's watching online, asks, what's the difference between Medigap and Medicare supplemental?
Well, a Medigap and a supplement plan are the same thing. Some people call them Medigap, some people call them supplements. So the differences are going to be Medigap/supplement plans versus Medicare Advantage plans, and we have slides coming up where we will discuss those differences.
Another question, they also ask, what's the difference between private insurance and Medicare Advantage?
Well, Medicare Advantage is private. Medicare Advantage is offered through private insurance companies. In Minnesota, that's going to be United Healthcare, UCare, Medica, Health Partners, Humana, Blue Cross, and Allina Health Aetna. They're all offered through private insurance companies. Medigap plans are offered through private insurance companies too. But the differences are, well, we'll cover those differences in a little bit. Did you have a question, sir? Yes.
I have A only. I'm working full-time with traditional insurance.
Okay.
Do I have to do anything during that annual election period, or can I just let it ride?
You can just let it ride until you leave your employer plan, and then you would need to, 2 months prior to leaving your employer plan, you'd want to get signed up for Part B. When you do that, there's a remarks section. You tell them what month you want your Part B to start, and yeah. Mm-hmm. Were those all the questions for virtually right now? Okay.
So this person asks that they know the rules differ from state to state. They're in Arizona. So
Okay.
what does Medicare look like across the U.S.?
Yeah, so every state you're going to have the option of a Medigap plan, supplement plan, or a Medicare Advantage plan. So that's going to be available whether you're in Arizona or Minnesota, Wisconsin, wherever you are. The rates are different for Medigap plans. So Medigap/supplement plans in Minnesota tend to be higher priced than in other states. That's because we have what's called community rated. So once you sign in, if there's a rate increase, which there's always a rate increase with Medigap plans, it goes up for everybody. It's not dependent on your age. Some states have what's called age-rated plans, where the older you get, the higher and higher your premium goes. So that's going to be one of the differences. I don't know what Arizona has for that, but otherwise, they're pretty similar across the different. There's going to be different insurance carriers for Arizona versus what there are in Minnesota. There's national carriers, meaning they offer plans in all states. That's going to be like United Healthcare, Aetna, Cigna, Humana, and then your state probably has local plans too, like whatever the Blue Cross is for Arizona or whatever state, and they probably have other options too. Okay. So what if I'm working past the age of 65? Again, it might be worth your while to compare what your cost is to stay on your employer plan versus going on to Medicare. And We talked about your Part B cost is going to be $175 if you choose to leave your employer plan, and then however much your monthly premium would be. Again, for Medicare Advantage plans, those plans start at $0 a month and then go up to $100 or more. So you'd fact those together. In Minnesota, the Medicare Advantage plans don't have a medical deductible. I don't know if Mayo probably has some plans where you'd have maybe a $3,000 deductible that you have to pay first. I don't know what their plan options are. So those are all the things you would factor together. And if you just wanted to meet to discuss that, we can certainly meet to discuss that. We can compare apples to apples and help advise you. Typically, I'm guessing with the size of the Mayo Clinic, I'm assuming they have good coverage, good options for you. I don't know, but we can help you compare that if that's something you want to do. And then I don't think I brought this up, but if you work for the Mayo Clinic, I think it's in Rochester, and for those of you in Arizona, you can chime in on chat if you want, but if you started working for the Mayo Clinic prior to 2001, you're going to need to use a company called VIA Benefits. That's who the Mayo Clinic uses to administer their retirees VIA benefits, because they give you reimbursement money that you can use if you go through them. You don't want to give up that reimbursement money because it's a fair amount of money you get each year. So if you started with the Mayo Clinic prior to 2001, you're going to want to go through VIA Benefits. And if you're eligible for that, the Mayo is going to send you information for them around the time of your retirement. My understanding is if you work for the Mayo Health System, so the clinics and hospitals beyond Rochester, they're not eligible to get that VIA Benefits money, but if I'm wrong on that, somebody can let me know. Yes?
I'm going to ask a question, I'm sure you can answer. I retired from Mayo, my spouse is on my benefits, and she turned 65 first. Will she be able to get the benefits?
She should if she was on the Mayo plan when you retired. And they will, I don't know how soon that is, but they should be sending you probably a few months before your 65th birthday. They should be sending you information about VIA Benefits. So, yeah, you're welcome. Yes.
So Charlotte Pace asks, I retired from Mayo in Arizona in 2017 and they now live in Illinois. Can you work with her in reviewing her coverage?
We can, yeah, we can work with anybody across the country. We're not, and we can get licensed in any state. We're not licensed in Illinois right now, but we certainly can. We have software that we just enter your zip code, whether you're in Illinois or Texas or Arizona, and it brings up all the plan options, and then we can enter what providers you go to, who your doctors are, and yeah, we can advise you, tell you what the different options are, to look at your prescription meds, and we can do that for anybody in the country. Okay. So we talked about the employer form. If you delay enrolling in Part B because you're going to continue to work, this is an example of what the employer form looks like. Section A, your employer completes. You complete section, I'm looking at this wrong. Oh yeah, Section A, the employee completes. Section B is completed by the employer. Signatures at the bottom. It's just a basic form that lets Medicare know that you didn't go without medical coverage. You had it through your employer. You, when you apply for Medicare Part B, say you're 67, you're going to retire and you need to apply for Part B. If you do that online, there's a place where you just upload this completed form when you submit your application, and then you're not facing a penalty for Medicare Part B. Yes?
Where do we get the form?
Either if you email us, we can send it, or your employer should have it, but I'm happy to send this form to anybody who needs it. It's, yeah, it's a basic form, but at the end when you see our, well, I guess you have, if you're here, you have my contact information, but just shoot me an email and I'm happy to send an attachment with that form. And then the cost of Medicare. So if you're high income, Social Security is going to tack on a surcharge for your Part B premium once you're on that, and also for the portion of your premium for Part D. And how that works is they look at your tax records from 2 years ago, once you're on this. And if you're a single filer, based on this year's numbers, if 2 years ago your income was $103,000 or more, and that's modified adjusted gross income, I think Social Security is the only one who uses that term, modified adjusted gross. But if it was $103,000 or more, they're going to tack on a surcharge. That surcharge is showing there. And if you're married filing jointly, if your income was $206,000 a year or more, they're going to tack on a surcharge for you. And that's going to last through the rest of the year. And then every year, Social Security is going to take a look at your IRS records to see how long they're going to continue issuing a surcharge on your Part B and Part D premiums. And if you're high income for life, you'll be paying that surcharge for life. If your income drops significantly once you retire, then after 2 years of retirement, because they go from the previous 2 years, you may no longer have to pay that surcharge. So it's not a lifetime surcharge, it's a yearly, monthly thing. And then private health insurance options. So we talked about there's different options. There's supplement or Medigap plans. There's Part C. So Medicare Advantage plans are called Part C, and they usually combine Part C and Part D together with Advantage plans. And then there's also Part D, Medicare prescription drug plans. So if you're going with the Medigap plans, they don't cover prescription drug coverage. So if you choose to sign up for a Medigap plan, you would want to add on a Part D standalone prescription drug plan. If you're going with a Medicare Advantage plan and you want prescription drug coverage, they combine all of that together into one monthly premium. So for Medigap plans, in Minnesota, we're a little different than the rest of the nation. Most of the country, they have what's called Plan A, B, C, Plan F, Plan G, Plan N. In Minnesota, we don't call them that. We call them basic, extended basic, a copay plan, high deductible plans. But in Minnesota, as I mentioned earlier, they're going to be higher priced than what they are in a lot of the country. So if you were to go with a supplement plan, that it's kind of like the highest level, where once you pay the $240 deductible, you aren't going to have any copays for your medical. Those are going to run you anywhere from $250 to $300 or more per month. And then you would need to add on a prescription drug plan, which those can run from $5 to $100 a month. And they're also not going to cover dental, vision, or hearing. So if you want dental, vision, and hearing coverage, you would need to add on policies for all of that if you have a Medigap plan. The plus of Medigap plans is there are no networks. Any doctor, any provider across the country that accepts Medicare will take your Medigap plan. It travels with you when you leave the state and when you leave the country. And if you relocate to another state, you won't lose your plan, your Medigap plan. Those are benefits. You will pay a lot more money for a Medigap plan than you will a Medicare Advantage plan. And again, if you join the plan 12 months after your Medicare Part B starts, they can ask you health questions. That's going to change next fall to where if you don't start out with a Medigap plan during that annual enrollment period that the legislature started for next fall, you won't be asked health questions starting then. Yes?
That sounds like a risk to the insurance company, so will that probably increase the overall cost significantly?
Oh, you can count on it. We're already seeing price increases for this fall as they're preparing. So it was well-intentioned to give people that opportunity, but you're going to see probably some significant increases in Medigap plans starting next fall, which may end up doing the reverse. It may end up causing more people to go with an Advantage plan because they're going to be even more economical. So, yes.
So Donna Boone asks, my husband is over 65 years old and he applied to only Medicare Part A since she is still working, but they did not send the employer form. Do we have to send the form now? Will there be a problem or a penalty? It's been 4 years since he applied for Part A.
So that's a good question. You only send in that employer form once you're ready to sign up for Medicare Part B, as in boy. So no, there won't be a problem. You don't need to do that until he's ready to sign up for Part B, probably around the time that you're going to retire and lose your employer coverage. So that's the time you would do it, and it's that employer form that's going to prevent the penalty. Okay, so Part C, Medicare Advantage plans. Additional benefits that they're going to offer in Minnesota and across most of the country now, they're going to offer dental benefits, hearing aid and hearing eye, seeing the optometrist, eyewear, most of them include an eyewear allowance. They also offer free gym memberships. They offer what's called maximum out-of-pocket protection. So what that is they're going to have a limit on if your copays were to add up to a certain dollar amount. If that were to happen to you, then after that the insurance company is going to cover you at 100% on your medical. It doesn't include prescription drugs, but they'll cover you at 100% on your medical. So an example is there's a popular plan in Minnesota that has a $2,900 maximum out of pocket. About the only way to hit that, because your copays aren't going to add up to that during the course of the year unless you're going to a facility to have infusions like chemotherapy or something. If you're going through chemo, you're probably going to end up hitting your maximum out of pocket. So it's just good to know that it's financial protection for people who are on Medicare Advantage plans, that you're not going to, once you reach whatever that level is, then the insurance company is going to pay 100% of your coverage. That's a good thing for consumers. Medicare Advantage plans have that, Medigap plans don't, because there's differences in the out-of-pockets. Medicare Advantage plans are network-based. Again, in Minnesota, the majority of Advantage plans, 90% or more of providers in Minnesota are in the networks. Some have a higher, there are some insurance carriers in Minnesota that 97% of providers are in their network. So it's not as scary of a thing as when Medicare Advantage plans first started in 2006, 2007, they weren't that great. And there's still people who hold the position they're not that great. They've improved drastically over the years to where the provider network is not a huge issue. These days, every Advantage plan, at least in Minnesota, if it's what's called a PPO plan, Preferred Provider Organization, they give you coverage across the country. They have networks across the country. So if you're traveling, say you go down to Arizona for the winter, or Arizona that's come up here for the summer, if you have a PPO plan, you're most likely going to be covered anywhere you go across the country. But they are network-based. If you have an HMO plan, which there are some of those still around, you most likely will need a referral before you can go see a specialist. I tend to stay away from those plans these days because there's so many PPO plans available that give you greater flexibility where you don't need a referral if you want to see a specialist. But there are HMO plans. If you have one of those, you probably would need a referral to see a specialist. These plans don't move when you do. They're county-based within a state. So let's say if you live in Olmsted County and you moved across over to St. Croix County or somewhere in Wisconsin or wherever you moved, you have 60 days, you would need to find another plan available in whatever county you move to if your plan wasn't available. So they don't cross state lines, and even within states, say you live in Olmsted County and you move up to Crow Wing County, depending on the plan you have, you may have to find a plan available in Crow Wing County. But that's some of the differences between Advantage plans and Medigap plans. Medigap plans, you can move anywhere across the country. You don't have to switch. That's not always a good thing because if you have a Medicare Advantage plan in Minnesota and you move to, say, Iowa, and I'm from Iowa, so I can say this, why do you want to move to Iowa? But that's just a joke. But Iowa, the Dakotas, a lot of states, their Medigap plans are much less money than they are in Minnesota. So if you have an Advantage plan in Minnesota and you move, you can take a look at Medigap plans in other states and you don't have to look at underwriting. They're not going to ask you health questions because you lost your plan against your will. If you have a Medigap plan in Minnesota and you move to another state, you don't lose your plan. So you can't necessarily pick up a Medigap plan in their state. You would be asked health questions, and as long as you say no to all those health questions you could, But if you said yes, then you're going to keep your Minnesota plan. Yes?
So, if I understand correctly, you said Medigap, there's no geographic, limitation.
Yeah.
With Advantage, there's done better, but what about international? Like, for example, just like you said,
Yep.
there's Medigap travel to like Mexico or Europe.
Yeah. So with Medigap and with Medicare Advantage plans, they will give you coverage, worldwide coverage. How that works is you're going to have to pay, if you're in another country, you're going to have to pay the bill up front before they let you leave the country. And then when you get back, you submit your expenses, and then you get reimbursed like 90% of that. It's usually a good idea to have some sort of travel insurance because, and I have clients who've gone through this, you know, they think, well, nothing's going to happen to me. Well, they trip and fall, and they break a bone, whatever happens, and they end up maxing out their credit card to pay in another country, and they've got no money left to spend on the things they had planned on buying when they're in another country. So travel insurance isn't necessarily cheap, and you feel like it was a waste if you didn't use it. If you end up using it, you're very happy you had it. And generally, you buy that through a travel agent or something. Yes?
So virtually this person asks, if you select a Medigap plan with copays and you need chemotherapy, would you pay the $20 copay for each chemo appointment?
Yes, you would.
Okay, and another question. MAP patients have had difficulty getting coverage at Mayo Clinic in Arizona. When someone applies for Medicare, is there a list of providers / hospitals that are covered?
Yes, so anytime you would sign up, if you sign up for a Medicare Advantage plan, well, at least that's what one of the things we always do for you is we're going to make sure whatever hospital or clinic you intend to use, that they're going to be in network with your plan. So the Mayo clinics in Jacksonville, Florida, and in Arizona do not take new Medicare clients. So if, yeah, it really wouldn't matter what plan you went with, they're not going to see you at those clinics if you're new to Medicare or on Medicare. Rochester will. So. And then Medicare Part D prescription drug plans. So this is what's called standalone prescription drug coverage. If you were to have a Medigap plan, you would want to pick up a standalone prescription drug plan to cover your prescription needs. These came into being around the same time Medicare Advantage plans came into being. There's different tiers of coverage. So every insurance carrier is going to have a formulary, which is a list of prescriptions that they cover. Tiers 1 and 2 on that formulary are typically going to be generic medications. Tier 3 and Tier 4 are going to be either the brand name medications or some of the more expensive generic medications. And then Tier 5 is going to be if you're taking any specialty meds, those are going to be the most costly medications. And then some insurance carriers offer also what's called a Tier 6, and that's going to be for the really inexpensive generic medications. So changes that are coming next year, well, I guess we have a slide on that. I'll go to that. So there's different stages to your prescription drug coverage. Stage 1 is if your plan has a deductible that you need to pay before you start paying copays for your meds, that's going to be stage 1. You'd have a deductible. A lot of the plans don't have a deductible, some do. Once you've met that, if you have that, then you move on to stage 2, which is your initial coverage where you have copays that you pay for your prescriptions. A lot of the plans these days, if they're Tier 1 medications, you don't pay anything for those meds. They're the inexpensive generics. If it's a Tier 3, typically you're going to be looking at, you know, like a $47 copay for a month's supply, month refill. And then this is the last year we're going to see stage 3 and stage 4. So stage 3 is the coverage gap or the donut hole. I don't know if any of you have ever heard anyone talk about those in the past. But that would be if you were to, if the cost of your prescriptions this year between what you've paid in copays and deductibles and what the insurance company has paid, if that reached $5,030, then you fall into the donut hole or coverage gap, and you're going to pay 25% of the cost of your medications, either until the end of the year or until you hit stage 4, which is catastrophic coverage. You would hit catastrophic coverage this year once the entire cost of your medications reached $8,000, and again, that's between what you pay and the insurance carrier pays. If you hit that stage 4 this year, you're not going to pay anything for your medications for the rest of the year. The change is going to be next year. They're doing away with stage 3 and stage 4, and they're going to, your costs for your medications are going to be capped at $2,000. So starting next year and moving forward, if the cost of your medications reaches $2,000, the insurance carrier is going to be required to cover 100% of your medication costs if you fall into that category. That's going to be a big disruption this fall for people who are already on Medicare, because you're going to see some price increases in premiums. There's several companies that are just going to stop offering standalone prescription drug plans. There's going to be a lot of changes this fall. So if you know of people who are on Medicare and they don't tend to have their plans reviewed, they're going to want to have that done this fall because it could severely affect them. Yes?
That's just in Minnesota?
That's all across the country. Mm-hmm. Yeah, so for those of you in Arizona or wherever you are, if you or someone you know is already on a Medicare plan, whether it's a standalone prescription drug plan or a Medicare Advantage plan, it's really good advice to have somebody review that for you. Hopefully us review it for you, but have somebody review that for you for next year. You don't want surprises come January. Yeah. So cost of Medicare, just kind of to recap. So Medicare Part A, if you or a spouse paid into the Medicare tax for 10 years working in the United States, you're not going to have a premium for Part A. Part B this year is $174.70. That'll change from year to year. If you sign up for a Medicare Advantage plan or Part C plan, those monthly premiums, at least in Minnesota, are going to run from $0 a month to $100 or more, depending on the plan you choose to go with. Or if you have a Medigap plan, again, no copay for Part A. Part B premiums, $175 approximately. Medigap plans, depending on the type of Medigap plan you chose, is going to run anywhere from $75 to more than $300 a month. It is based on the company you use, if you're a smoker or a non-smoker, any additional riders you purchased, all of that's factored into the Medigap plans. Medicare Advantage plans, they don't care if you're a smoker or a non-smoker or any of that. So that gives you some costs there. And then you need, if you go with a Medigap plan, again, you need to add on a standalone prescription drug Part D plan, and those can run anywhere from $0 to $100 or more. So if you do the math, you can see Medigap plans are going to be considerably more expensive per month. But again, if we meet one-on-one, we're going to discuss your needs, your wants and desires for your health care coverage. There may be good reasons why you want a Medigap plan versus a Medicare Advantage plan. Yeah, any questions on that? Yes?
So, on the or side, you have Medicare Part D. Could that come across the line on the other side?
So the Medicare Part C plans include Part D together for that one monthly premium. So you're not paying additional money for Part D when you have an Advantage plan. Yep. Yes.
So if you have a retired married couple, do they usually probably have the same thing, but potentially based on their individual health needs and prescription needs?
Yeah.
You could potentially have different plans?
They could. So the question was, if you're retired and you have a spouse, do you typically have the same plan as your spouse? No, that's not always true. I've worked with a couple last fall. The husband was going through chemotherapy, and that was probably going to continue, so he had a Medigap plan, and I helped him get a more cost-effective prescription drug plan for him. The wife went with an Advantage plan because she went to the doctor once a year, and they didn't want to spend over $300 a month for her health care when she sees the doctor once a year. So no, it can, oftentimes spouses will go with the same plan. They're all individual plans, so you can make an individual choice. They're not, they don't cover both you and your spouse, but oftentimes spouses will go with the same plan, but other times they choose not to based on their health needs. Any questions, any more questions online? No? Okay. So this is going to be one of the final slides, but if you decide that, yes, we need help, if you know you're going to continue working for a while, you don't necessarily have to fill out one of these permission to contact forms. We call them permission to contact forms because just because you came to this seminar does not give us the right to start calling you and emailing you. We need your permission to do that. So if at some point, and you know today is that point, if you want us to contact you to discuss your situation, maybe you just want more questions answered, you're going to continue working for a few more years, but you still have some questions you want answered. If you fill out this form, we will contact you at the appropriate time, or for those who are attending virtually, I'll get to that slide. Here's our contact information. Don't contact Chris, but either Michaela or myself, Dave Brown. You have our cell numbers if you want to text or call, or you have our email addresses. You're certainly welcome to contact us if you have questions or if you need help getting signed up for Medicare. We're here to help you if you need it. So I don't know if there's any final questions you have. We'll be here later once we conclude. If maybe you have a question that's kind of private and you don't want to ask it in front of everybody, we'll be here to answer those questions. If you're attending virtually, you're certainly welcome to email or text us or call us if you have questions about something that either I said that didn't make sense or just something that you have questions about for Medicare. We're happy to help you. So feel free to give us a contact. And with that, thank you for coming. We do, if you didn't get some giveaways over here, we have giveaways, pill boxes, and little flashlights and pens and so forth. You're happy to help yourself to that. But we would love to help you if we can be of help to you. So